Hi, today we're going to be talking about conceptualizing addiction, an important skill and important ability when working in the field of addiction and recovery. And conceptualizing addiction, we'll be talking about various different things today that would involve the assessment and recognition of the disease of addiction. And so all of the terms that we'll discuss will be important as you begin understanding more about addiction and how to treat it. One of the first things we want to talk about is maybe the nomenclature that often gets used when working with addiction. Most commonly in the field right now, addiction would more commonly be referred to as a substance use disorder. Obviously, that makes things more specific to us just talking about substances rather than maybe some of the behavioral process addictions, such as gambling or shopping or addictions of that nature. So calling something a substance use disorder gets us into a more specific area when we're talking about addiction, specifically addictions to substances. A substance use disorder is the term commonly used by the academic and research field right now. One of the reasons is maybe political reasons, as it is felt that saying substance use disorder may not be as pejorative as calling somebody an addict. That is something the field is kind of moving away from right now, is calling someone an addict. You might be appropriate to say this person has an addiction, but more and more you're going to hear people using the term substance use disorder or whatever disorder it might be that they're struggling with. And that term, substance use disorder, is what is used by the DSM, the Diagnostic Statistical Manual of Mental Health Disorders, put out by the American Psychiatric Association. And the DSM assesses substance use disorders, and in that manual, a substance use disorder can be diagnosed as either mild, moderate, or severe. In the DSM-4, they used to diagnose substance use problems a little differently. You could get a diagnosis of abuse or dependence, and they had separate criteria for those two different diagnoses. However, now they've in the DSM-5, which is now commonly being used by practitioners, they have done away with those separate distinctions, and there is just one set of criteria that is used to assess a substance use disorder, and the results of the questions you ask and how many the person being diagnosed says yes to, that will determine if they are diagnosed with a mild, a moderate, or a severe substance use disorder, or SUD. Now, it would also be important for us to mention that in the DSM, there is something called a substance-induced disorder. And in your reading, it addresses the difference between a substance use disorder and a substance-induced disorder as well. A substance-induced disorder is some other kind of problem, can be a mental problem, that was substance-induced, such as if someone is experiencing depression, but they're not necessarily clinically depressed, they don't have a major depressive disorder, their depression was induced by the use of a substance. Or hallucinations. When people hear hallucinations, often people think of diagnoses like schizophrenia, but it is possible that people have hallucinations or other delusions, paranoias that are substance-induced, and they're not necessarily the result of a mental health issue. And in those circumstances, someone could be diagnosed with a substance-induced disorder. But typically in this course and in this lecture, we'll be talking mostly about substance use disorders where the substance use itself is the disorder and not causing some other disorder. It would also be important for us, when talking about the conceptualization of addiction, to discuss the difference between psychological versus physical addiction. Some people really get hung up on the difference between these two. Others think that it's not so important that we make a clear distinction between a psychological and a physical addiction. On the PowerPoint here, there's a link to a brief column from a PhD researcher trying to outline the difference between a physical and a psychological addiction, and I've pulled that up here. And Dr. Jaffe kind of basically walks through, and we won't read through this in this lecture, but he basically talks about the main differences. When people talk about a physical addiction, they're talking about the physiological process of tolerance and withdrawal, and whether or not the body goes through a physical withdrawal from a substance if the user is not using. And that's what, when most people talk about a physical addiction, that is what they're talking about. Psychological addictions, on the other hand, he makes the point in this article, also have withdrawal. It may not be the long drawn out, extremely painful flu-like withdrawal that you would get from something like opiates. But he says somewhere in here that, make no mistake, even with a psychological addiction, people can experience withdrawal symptoms such as fatigue, depression, anxiety, sleep disturbances, trouble eating. And he makes the argument that even our psychological experience is connected to our physical makeup. And that's a good point. We don't understand greatly the link between our physical bodies and our psychological self, but we know they are linked. And at the end, I would just point you to this sentence he has here at the very end of his article, that as far as I'm concerned, if you have a behavior that is making your life miserable and which you can't seem to stop, it doesn't matter if you're throwing up during withdrawal or not. It is an issue and you need help. So it's important to know the difference between a psychological and a physical addiction, in the sense that there are many people who discuss them differently in the academic literature and in the professional treatment fields. Some people consider a psychological addiction as less severe or less problematic than a physical addiction. But really, that's not the case. They both involve psychological and physical aspects at some level, even if we don't know exactly how that looks and works right now. I would also add to that brief discussion on psychological versus physical addiction that a physical addiction, if it really is just about whether or not there's a severe withdrawal from the drug, then the treatment for a purely physical addiction would just be detox, and everything else done for the client would be to treat a psychological addiction. But there's more to be learned and researched into the phenomenon of psychology and biology, and we'll learn more about that as time rolls on. In your chapter about conceptualizing addiction, there's several terms that are brought up that you should know that will be important to you to be able to discuss and understand and treat and work with addiction competently. Drugs, for example, are anything that is introduced into the body that creates a physiological effect, and psychotropic drugs are simply drugs that have a physiological or altering effect on the mind. Substance use is using a substance. Abuse is when you've used the substance to the point where you have negative consequences. I'm explaining some of these very simply and quickly. And dependence is when you now need the substance to function. And for many of you, you've probably taken courses or read information about a continuum of how addiction develops. Craving, I think most everyone at this point might be familiar with. Tolerance, we briefly just talked about, along with withdrawal. Abstinence is refraining or abstaining from substance use. A relapse and a slip are mentioned. Many people will call a slip a lapse, and from that framework, a lapse is a brief return to using behavior, whereas a relapse is a full-blown return to a using lifestyle. And we may talk about that more later on throughout the course. Then, of course, there's recovery and dual diagnosis, which is when you have a mental health disorder or some other disorder and an addiction simultaneously. The main models of addiction, to keep it simple when trying to discuss the etiology of addiction or why addiction is happening and what's going on, would be the moral model, the disease model, and the family systems model. The moral model is simply that addiction is a moral problem, that people have choice and they make poor choices, and if they would make better choices, they would stop their using behavior or their addictive behavior. The disease model comes at it from understanding the brain and the intricate functioning of the brain a little bit more detailed and in depth. And from the disease model, we understand that choice gets impaired because of changes that occur in the brain and how the brain structure gets altered during the course of substance use. And from that perspective, it's not just that someone is immoral or can't make good decisions or can't pull themselves up by their bootstraps and make their life go the way they want it to go. It simply means that their ability to make good choices has been impaired. They are a patient, they have an illness, and they deserve treatment. It does not excuse their destructive behavior that has negative consequences for themselves or toward other people, but it is a different way of coming at and understanding addiction. One last perspective we'll briefly mention here is the family systems model of understanding addiction, and that's going to be relevant to this class as we discuss family dynamics around addiction and how systems work to describe interactions between people and in networks of relationships. And from that perspective, addiction can be seen as just resulting in this important term we call the identified patient, meaning that things that emerge in a system, diagnoses like addiction or mental health issues, may likely be a function of how that network, how that group, how that family functions together. And when there's problematic or pathological relationships or behaviors between the members of that system, something ends up emerging like an addiction or depression or some mental health problem. And the purists of the family system model would say this better explains what's going on, maybe even than underlying moral issues or disease facets going on in the brain. All of these things are important to understand and to know, but from this course we're going to be talking about the family systems model of addiction and present to you some ideas that will also temper with understanding more about the brain and that there are intricate individual dynamics going on in the brain as well. So from that perspective, we'll introduce to you the idea of genograms from the family systems perspective. You'll learn more about that later in the course. In fact, you'll be constructing a genogram of your own family. This is just an example one of some family called the Smith family, where you will map certain characteristics and behaviors and relationship interactions between family members going back over the course of generations. And from that perspective, you can begin to see patterns and networks and see how things have occurred and maybe even transferred over generations that impact why people experience what they experience. And that will become important as we discuss the family systems model. And with that, we are going to end this brief lecture on some important parts of conceptualizing and understanding addiction, especially as we introduce this course on the family dynamics of addiction. And I will see you in another lecture.